Hi, Lisa White here with another clinical conversation with our friend Dr. Greene. How are you doing, Dr. Greene?
I'm doing great. How are you today?
I'm good, thank you. Thanks for joining me for another clinical conversation.
Absolutely.
So today's topic, we're going to be discussing non-medical fertility challenges to starting a family.
Yeah, one of the things that too often gets glanced over and doesn't get enough attention is we see a growing number of people that really have what appear to be non-medical reasons that they aren't getting pregnant. For instance, if a woman is single and wants to have a baby, she needs sperm. If
Mm-hmm.
you're dealing with a same-sex couple, again, if they're women, they need a sperm donor, or if it's two men, they need both an egg donor and someone to carry the pregnancy. And
Yeah.
so, a lot of times people in these situations, they don't feel that they have infertility by the standard definition
Right.
because they've never tried to get pregnant. But
Mm,
at the same time, they have a challenge to becoming pregnant because there's certain biological needs for both egg and sperm and someone to carry the pregnancy. And so social fertility, which is the term that we're using to try to identify people that are in these situations, is a segment of the population that unfortunately hasn't gotten enough attention and support.
mm-hmm. Well, I'm really glad that we're talking about this today. And as we know, fertility challenges, they don't discriminate.
Well, exactly. And, give you an example. You and I have talked about the fact that Colorado, where we live, is in the process of becoming a mandated state for fertility coverage. And it'll make us, I believe, the 17th or
Yeah.
18th state
So,
with a mandate. And part
mm-hmm.
of what we did is we worked with the legislators that were creating this law to try to make sure it would include this segment of the population, that people that are single by choice
Mm-hmm.
or people that are in a same-sex relationship, they have the same rights and needs to want to achieve a family as anybody else.
Exactly. Reproductive rights, right?
Exactly.
Yeah. So more and more, like, pardon my dog in the background.
Life in a pandemic.
Oh my goodness. Um, are you seeing more women, more men, individuals, same-sex couples coming in who, are looking to grow a family? And
I wouldn't say more. I just, like I said, one of the things that we've always tried to reach out to various communities, through our social outreach. But we realize a lot of people don't look at, what's being put out by a fertility center until they're well into the process. And I
mm-hmm.
know from like patients that I meet with, I'll give you an example that I don't recommend, and I want to be really clear on this, but like I'll meet with single women or same-sex couples that have been doing home inseminations. And there are people that they view that the only reason they're not getting pregnant is the absence of a sperm. And just like almost everything else, sperm, you can buy it on the internet,
Yeah,
and
maybe
there's a lot of
shed some light on this because it's fascinating,
there's some really shady situations because you don't really know, for instance, what the fertility status or the health status is of the person that might be selling the specimen. You don't know if they've been screened for sexually transmitted diseases. And even more bothersome is you don't know, like that same person may have fathered many, many other children. There have been stories, for instance, of some guys, selling their sperm on the internet, and then you find out years later through things like 23andMe that guy might have 50 or 60 children in different parts of the country, and so people have to be cautious. And, we respectfully handle each person's situation, regardless of how they got there, with respect and dignity, and always trying to focus on the ideal outcome. And that ideal outcome should be defined by that patient, and in terms of what's the ideal number of kids that they would have.
So would you advise not going that route, go to the internet to come to a fertility clinic? And
Absolutely would not recommend it. It's dangerous. I mean,
yeah.
literally, I don't mean to scare people, but you could catch HIV or hepatitis C, all sperm donors that are screened appropriately, we make sure they don't have syphilis, they don't have HIV, they don't have hepatitis C. And they're always screened to make sure that they don't have a history of drug abuse or any genetic conditions that they could pass on to a child. And they're also screened to make sure that they don't father too many children, and so, there are ethical guidelines that need to be established. And part of the other thing is people don't realize how low success rates are for home inseminations, and the sperm specimens can still be very expensive.
I'm going to pause for 1 second. Okay, thank you for your patience on that. Put my dog away. Other than cost, what other things do you help clients address, on their path to parenthood?
Yeah, well, one of the first questions I always begin every consultation with is, what's the largest family someone could imagine that they want to have? And the reason that's important is, if someone wants to have more than one child and they're using, some donor that they don't really know, how do they even know that they're going to be able to find that person if they want to have a sibling later on? So that's an important thing to talk about, besides the screening of the donor and the cost of the sperm specimens. Another thing that's very important that most people don't realize is that the diagnosis of infertility is established after, a heterosexual couple has been trying for a certain number of months without success. But the difference is for a heterosexual couple, there's no cost for them to try on their own. And, sometimes I see people that have tried 6 or 10 cycles of donor insemination before we, would see them in the office, and they were doing home inseminations for nearly a year. And I say, well, you know what? We have to start by making sure that there's not some underlying cause of why you're not getting pregnant. But for all I know, that you might be working with a donor that just doesn't have good sperm. And we can't know that unless we put you through some testing first.
Right.
So I think it's really important that people should understand what the natural fertility rate is when people are trying to get pregnant through the most traditional means of just having, sexual relations, and then talk about, the limitations of things that are available through technology.
Thank you. I was just kind of looking up social fertility as a term I haven't really heard before. So I'm glad that you're shedding light on this. And I was reading a definition, it's shaped by a person's relationships and circumstances rather than a purely physiological diagnosis.
Exactly. And just because there's a social fertility challenge doesn't mean there might not also be some underlying thing that might also reduce success rates. Like, for instance, if a woman is not releasing an egg on a monthly basis, or has a blocked tube, or has uterine fibroids, these are things that, someone didn't find out until they tried, a certain number of cycles successful. It could be very costly.
I'm so grateful, we have assistive reproductive technology for everyone, to come in and for the opportunity to start or grow a family. Thank goodness for science and for your ability to help everyone who wants to be.
Well, and the reality is this is why, we should make sure that people know what's out there, know what's available, and honestly be empowered to go through the appropriate channels to plan accordingly. Because, in a similar situation, another social fertility status is, we're finding, most women are very aware of the fact that biology can limit their chance of success. If they wait too long to try. But if someone is on a career path and it's not the time in their life they want to consider starting a family, freezing eggs, for instance, that could then be used later on, is also a tool that women have available to empower and expand their reproductive rights, so that they have greater flexibility. If they want to wait and have their first child at age 40, if they freeze eggs when they're 33 or 35, it gives them the ability to do so with greater confidence.
No, I'm so grateful. I have friends too that have frozen their eggs, people that have chosen to work and postpone motherhood. And
so again, social fertility issues aren't always about creating a pregnancy now. It's sometimes extending your options so that you could also have the greater ability to have a pregnancy later, if now is not the right time.
And you said too, like you mentioned a lot about sperm, and like for men in same-sex, relationships, and they want to have a child. And so having a surrogate and getting the eggs tested and the egg donor, all of that. I mean, there's a lot.
Well, and not only that, the other thing that's very important for men, whether it's a single man or a same-sex male couple, is having the right legal arrangements lined up. Because if that's not done appropriately, then the guys can find out later on that if the person that carries the pregnancy changes their mind, they could find out that they might be in court. And not only have there been situations where they've not gotten custody of the child that they fathered, but sometimes they're on the hook for child support, even though they're not able to raise the child. And there are precedents that have been set in some states. Luckily not here in Colorado, because we have laws to try to prevent those types of things. That, so there's social issues. Sometimes there's some underlying medical issues, but then there's also legal issues that need to be addressed up front to protect people that are intended parents, whether they're single or in a same-sex relationship.
I'm really glad you brought that point up. I did an interview, a soul sister conversation with a lawyer here in Colorado who handles, all those contracts, and oh my gosh, it was so enlightening. Ellen Trakeman's her name. We just talked and it was really enlightening. So definitely go through the legal.
She's absolutely fantastic.
Yeah, the legal process. Gosh, I'm trying to think of what other questions I have for you. Are there any tips you can give us?
Well, I mean, the best tip is for anyone that feels that they want to know their options. The best thing to do is they should set up a consultation, whether it's a single person or a same-sex couple, to really explore what their goal is, and then be able to do some very basic testing so that they could understand what their biological timeline is, if it's a woman particularly, because fertility declines at a younger age in women than in men. And then being able to be proactive and informed instead of reactive, instead of just jumping on the internet and looking for what you think might be the most obvious pathway to success, because too often that's a pathway to problems and situations that are best avoided.
Yeah, that's really scary. I mean, I don't even know. Can you Amazon? Can you buy things like that? I'm just like,
unfortunately, yes.
Oh my God.
I've literally had patients tell me about experiences where they've arranged things online and, kind of a shady looking character shows up on their doorstep with the specimen, and those situations do exist. I'm sorry to say it, but they really do. Maybe
that's a whole nother talk one day. I don't know. Oh my goodness. Wow. Yeah. Go through a clinic, a highly reputable clinic. Right. Starting off on the right foot. Oh, I'm so grateful to you for having this conversation with me. And I know you can be reached at enhancingfertility.com, conceptions. I'm at ivfmanifestingamiracle.com. And I think this might be our last clinical conversation for 2020-21.
Yeah, well, and it's a perfect time to talk about things like this, because a lot of people do goal setting. So anyone that's setting a goal of trying to, start their family in the coming year, these are things you should be thinking about.
Definitely. Yes. Please send in your requests of topics you'd like covered. We love getting, your requests of what you'd like to hear more about. And again, I'm Lisa at IVF Manifesting a Miracle, here for you for fertility support. And thank you all, as always, Dr. Greene. You're wonderful.
Stay happy. Happy holiday.
Yes. Happy 2022. Bye-bye, everybody.